Welcome to Dental Bites. In today's episode, we're going to talk about dental anxiety and communication. So, what is dental anxiety? Dental anxiety is a term to describe the state of fear, anxiety, or stress in a dental setting. It is a very common problem. According to a study, it is affecting as many as 36% of the population in Australia. Now you may ask, what are the effects of dental anxiety it might have on a patient? Well, first of all, it keeps the patient from going to the dentist. Regular dental visits are important for maintaining healthy teeth and gums. Yet dental anxiety, which is an unease about dental appointments, keeps some people from going to the dentist. Second, it delays necessary treatment. Most dental disease is lifestyle related and preventable. By avoid going to the dentist, not only are you more likely to need more complex treatments when you do finally attend, but you're also missing out how to take care of your teeth. Third, compromise maintenance of oral health. Lifestyle factors that lead to dental disease are very similar to those that lead to diabetes, obesity, heart disease, stroke, and some cancers. So taking care of your oral and general health is very important. So what exactly causes dental anxiety? Well, there's a variety of causes, and they can be divided into the following three categories. Previous traumatic dental experience, triggers such as sound and needles, and mental health conditions such as anxiety and PTSD. Previous dental trauma. A bad dental experience from other dentists in previous years can result in dental anxiety. The dentist can be condescending, neglecting the patient's emotion. This would have traumatized the patient and created a bad reputation for dentists in general. Triggers. Dental anxiety can be associated with certain triggers such as needles, drills, or the dental settings in general. The view that the mouth is a personal area and accessing the mouth is an invasion of personal space could have given the patient dental anxiety. Also, the fear of pain by injections or needles can also trigger dental anxiety. Mental health condition. Some mental health conditions including generalized anxiety disorder, depression, post-traumatic stress disorder, bipolar disorder, or schizophrenia can increase the risk of a person experiencing dental anxiety. Now, let's meet Sarah. Like you and everyone, she's also suffering from dental anxiety. Don't want to be as stressed as Sarah? Don't worry. Let me teach you a few strategies that you can use in the dental chair. Understanding what brings you fear. Most patients don't really know what triggers their dental anxiety. By identifying the source of it and understand your triggers, you can inform your dentist about your triggers, and this could avoid triggering the dental anxiety. Strategy 2. Distraction. Visual or audio distraction, such as music, can divert your attention, so you wouldn't pay that much attention to that particular needle or sound in the dental settings. Strategy 3. Meditation. Meditation can produce a deep state of relaxation and a peaceful mind. This action can relieve your dental anxiety before attending dental treatment, so you can have a more relaxing, peaceful, and enjoyable dental experience. Dental anxiety is a two-way street. Here are some strategies that a dentist can use to relieve the patient's stress. Strategy 1. Communication. A clinician must have exquisite communication skill. It is important for a clinician to communicate with his or her patient so that dental anxiety can be identified and addressed. This will allow the patient to explain their fear, what triggers them, and what makes them more comfortable. Clinicians can also factor this into treatment plan so as to relieve the patient's anxiety through medication, daily exercises, or preventative measures. This will also help establish transparency and rapport between the patient and the clinician. Strategy 2. Decorating a dental office. Decoration around the office can change a patient's perception about the dental clinic. Some changes in the color of the wall and some posters with some comfortable couches can really relax the patients and relieve dental anxiety.
Strategy 3. Medications. Sometimes when the dental anxiety is too severe, the clinicians might need to prescribe medications to relieve or even sedate the patient. Conscious sedation, such as nitrous oxide, can sedate a patient during the dental treatment so that dental anxiety can be avoided. Some anti-anxiety drugs can also be used to relieve stress symptoms. However, beware of the side effects that they might bring. Dry mouth is one of the most common drawbacks of these medications. But the most important part that a clinician can do to relieve dental anxiety is communication. The Calgary-Cambridge Observation Guide is a tool that a clinician can use to communicate with the patient with more transparency. So what exactly is Calgary-Cambridge Observation Guide? Calgary-Cambridge Observation Guide is a practical teaching tool in patient-clinician communication. The guide, since its introduction, has evolved to be a framework for communication at an everyday basis in the medical field. You might also ask, is it effective? Yes, it contains the key concepts on patient management with dental anxiety through communication. By using the guidelines, clinicians can thoroughly explain the treatment to the patient and obtain consent from them. Patient can understand the treatment in layman's language, preventing any miscommunication, and establish a trusting relationship between the clinician and the patient. Lastly, remember, communication is the key to relieve dental anxiety between patient and the clinician. It is also the key to unlock the trust within the patient. Thank you.